right, we're going to go ahead and get started. So thank you everyone for being here today. Today we're going to be talking about health disparities in education as it relates to tobacco use on campus. We will be going from 9 to 10 today. And as you may have seen, we are recording today's training. So we will be sharing all of that information and resources with you once today's training is done. If you are new here or just need a little bit of a reminder, our unit, the 2B unit, which is Tobacco Use Prevention Education, we provide support to all 80 LEAs in Los Angeles County. The way we do that is by providing trainings like this one, but also building capacity through staff teacher training on site. We also do work with prevention and intervention curriculum, cessation references, and we also do a lot of family, student, and community engagement. Really what we do is support school districts and LEAs with their vaping issues, basically. And so our information is at the bottom if that is something that you and your school site might be interested in. We are always willing to meet you where you are in this 2B, vaping, anti-vaping on campus journey. Our team is made up of 4 people. We have Mark Hernandez, who is on our call today. He's the program coordinator, and he will be managing the chat today. So if you have any questions or any statements, go ahead and feel free to drop them into the chat, and Mark will answer them for you. I am your presenter today. My name is Linnell Lujan. I use she, her pronouns, and I'm the Senior Program Specialist here in the 2B unit. We also have Kira with us today. She is the Senior Program Activity Specialist. She works with direct services with students, parents, and community to do this work. And then the glue that holds us all together is our Division Secretary, Jasmine Martinez. A little bit of housekeeping. As I said, today's webinar is being recorded. So if for some reason you need to step away, I know that we are all in the midst of our workday today. So if for some reason you need to step away or sign off early, do not fret. This recording will be shared with you at the end. We will also be sharing the materials, the PowerPoints, any links or resources that we talk about will also be included in that email. And of course, again, feel free to ask questions in the chat. There's going to be a couple of opportunities to participate in some of today's training just in the form of questions. So please feel free to utilize the chat at those moments. All right, so what we're going to be going over today, just as a disclaimer, today's training is really just a very general and brief overview about health disparities as it relates to tobacco use, vaping on campuses. So for some, this might be sort of preaching to the choir, right? For others, it might be a little bit of new information, but it really is to lay the foundation for our second part, which is how to engage students within these health disparities, student-focused groups. And so just as a disclaimer that this is just really going to be a general overview of what health disparities look like in schools as it relates to tobacco use. So we'll talk a little bit first about health disparities and the roles of social determinants, some of those definitions. We'll look at health disparities specifically in tobacco use and how the tobacco industry targets vulnerable communities. And then we'll get a little bit more narrow what these health disparities look like in our schools and how they impact our students, their wellness, their achievement, and even school climate. And then, of course, as always, my favorite part is the resources. What can we do here in our unit to help support you in your school and your students? First, I want to start off by talking a little bit about ceremonial use of tobacco. Today, as we talk about tobacco use, today's discussion is going to be really focused on the commercial tobacco. That should not be mistaken or confused with the usage of tobacco for religious or ceremonial use by American Indians and indigenous communities. What we're really focusing on is the commercial tobacco as it is mass produced and sold for a profit by these companies, and how they add addictive substances to this tobacco to target our students, to target young adults, to target pretty much anybody for a profit. So I want to just make that clear. So we'll start off with just the general overview of health disparities, right? When we're talking about health disparities, we're talking about health inequity, which means that, or health equity, which means that everyone has a fair chance to be as healthy as possible. And from our lens, what that really means is including being free from commercial tobacco, right? Again, health equity, health disparities is a larger topic, but for our purposes, we're really going to look at it through the lens of tobacco. Some of the factors that can relate to this can be race, ethnicity, location, right? Urban, rural, and jobs or careers. And these things can limit the opportunity for some people at having health equity. When we talk about health inequity, it's often referred to as health disparities. And health inequities are those avoidable differences in health status between groups of people. So they persist when that distribution is unfair. They reduce, it's done by reducing and ultimately eliminating the unfair distribution of wealth, power, and resources. And really, if a health outcome is seen as a greater or lesser extent between these populations, then that's an indication that there is a disparity, right? And so this is really what we want to focus on when we're talking about our students in campuses, because as we may or may not know, it's these things that even though our youth and our students, at this age, it can carry on into adulthood and into further generations. And we'll get to that in a little bit. So the social determinants of health, these are the conditions that we live in, that we learn, where we work, and where we play. They shape the well-being of our lives. In turn, they are determined by the distribution of wealth, power, and resources. When we're talking about this in our TUPE lens or in our TUPE unit, a great example of this would be, for instance, the fact that children are more likely to smoke when they live or go to school in neighborhoods with high density of tobacco retailers. So one of the social determinants of student use, besides internal, so like maybe they're doing it to feel less anxious. The other is the external part, right? So how many billboards do students pass on their way to school that are promoting smoking? How many smoke shops are on the corners near their school, right? So the more that they have sort of access to or in their lives, they're more likely to smoke. So the conditions of their environments really do matter. So I love images and I love infographics. I really liked this one because it's a great image of what to know about health disparities. We know that they can last for generations. So again, students who are experiencing health disparities, it is very likely that their parents had also experienced the same type of disparities. And it's also possible that their children will also experience the same type of health disparities. Closing the gap requires addressing social determinants of health. It is perpetuated by discrimination and income and inequity, which we are still, sort of dealing with today. differences in health linked to social and economic disadvantages, right? When I was a high school social science teacher and I taught government, one of the things that my students were really, really, I guess, surprised about was, as adults, there is this idea of, when you get sick, one of the first thoughts, right, is how much is this going to cost me? Am I going to need surgery? How much is my copayment going to be? How much is my insurance going to go up, right? And so, like, these economic disadvantages really do affect our health and our access to health, right? Um, and so, these are some of the things that we are dealing with. So, what does the research say? The research has revealed that racial and social economic disparities in access to healthcare and insurance coverage for students and their families. These gaps in access to care also exist for individuals depending on other potential intersecting categories. So, this can mean disability status, language proficiency, immigration status, sexual orientation, living in rural areas. And again, in LA County, all of these apply to our students, right? We have students who have different language proficiency, different immigration status, different disabilities, different abilities. And so we really need to focus on some of these categories in order to address this for our students. One way that state policymakers have sought to expand equitable access to health within our schools can be seen through community schools, wellness centers, if you have those on campus. And so this is some ways to tap into support when doing this work and addressing these health disparities for our students on campus. So disparities do persist with tobacco use. As you can see here, tobacco use remains high among US adults with these characteristics, right? And so we see some of these categories in terms of those who belong to the LGBTQ plus community, those who are coming from low income, rural areas, Black or African Americans, education status. These numbers are high amongst these groups. And so this is showing that there is going to be a disparity within those groups. While this is adult data, it is easy to say that this is also going to reflect in our youth. And of course, as we know, our youth one day will be adults, right? And so if this trend persists, then we're not closing that disparity gap. So that leads us to our next topic, health disparities and in tobacco use. So we know that the tobacco industry has targeted Black Americans for decades. And we can see that in advertisements, in movies, in commercials, magazines, billboards. This one here is from 1970, and it kind of shows, these proud Black and African American couple with a cigarette in their hand, right? It makes them look cool. It makes them look strong. And this is just one tactic in one way that, the tobacco industry targets certain communities, specifically vulnerable communities. Again, I just really love visuals. They help me remember things. But discrimination, poverty, and other social conditions are associated with commercial tobacco use, and it can make it harder to quit, right? Especially if the act of smoking or tobacco is somehow, part of that culture. It's part of who they are, right? And so these social conditions, such as discrimination and poverty, are associated with this commercial tobacco, and it makes it harder to quit. It makes it harder to resist. It makes it harder not to start, right? So when we're talking about vulnerable populations, here are 8 ways that tobacco affects vulnerable people. Take a minute to look at these. There's a lot of information there, which is why I really like this infographic. Um, Again, this is going to be statistics for adults, but it will still apply to our students, especially if some of these adults are parents to our students, right? Um, we can see that different types of vulnerable people are affected. Those with mental illness, 50% of LGBTQ adults, or tobacco use is over 50% higher among LGBTQ plus adults. Asian American men smoke at 215% higher than Asian American women. 1.5 times as many Hispanic middle school students report using tobacco compared to their other middle school students. 2.4% of people in remote areas smoke. 14.7% of their urban counterparts smoke. Tobacco use is 310% higher among homeless adults compared to the general population. And again, African Americans smoke menthol flavored cigarettes at nearly 3 times the rate of white, and are more likely to die from smoking related illnesses, right? And again, this is because that community is targeted with these products. And finally, tobacco use is 35% higher among American Indian and Native, or Alaskan Native. So here's my first question for you. Very simple. In the chat, what is one data point that you found surprising? After seeing all of this information, which is provided to us by the LGBT Health link, what is one of these that you found really surprising? I think for me, the fact that tobacco use is 310% higher among homeless adults. I can only imagine what that might be like for our unhoused students, right? Whether that means that they are also falling along with this trend. It also begs the question of, why? We know that when we look at students, youth, right, through K through 12, one of the main reasons that they report using tobacco products or vape is that they are using it to basically self-medicate, to not feel so stressed or anxious or depressed. And this might be a reason why. Yeah, that was really surprising. The tobacco use among homeless adults, that's really, really high than the general population. And to think of that as well, right? Like what sort of health conditions are coming with that smoking? And what sort of like medical attention would they need that they're not getting, right? Thank you. So here is a graph. This graph is African American mortality chart comparison. And there are 3 bars here that are not labeled on purpose. These 3 bars are going to show us, the mortality of African Americans. So take a couple seconds to look at this chart. What do you think the 3 bars are representing? What do you think each bar data point is representing when it comes to African American mortality? Are we thinking lung cancer, heart disease? What are 3 things that you think are going to be shown in this graph in terms of what are the top mortality data points for African Americans? Go ahead and drop that into the chat. Is it going to be heart disease, cancer? What are the top reasons for the mortality rate of African Americans? Oh, accident and injuries. I like that one. Yeah. Heart disease, cancer, lung cancer. All right. Thank you. So here's what we have. The largest one is tobacco deaths. And then not even close, right? Coming in second and third, homicides and AIDS, which is a 2012 data point. And this is really just to show again that the tobacco industry really spent a lot of money and a lot of time and years really targeting this group, right? Black and African American um, population. And we know that it's really, really disparaging, right? Um, Obviously, because it now has accounted for all these deaths in this group of people because the tobacco industry has done such a good job at targeting this group. So we're going to watch a quick little video put out by Truth Initiative about this topic. Very, very quick. So hopefully everybody can hear it.
For decades, Big Tobacco targeted minorities with menthol cigarettes. Here's some of what they did. Identified and profiled black communities.
More than 75% of African American smokers use menthols.
Appropriated black culture. Flooded the neighborhood.
Can't get away from it. It's all around us.
This addiction was designed.
We grow cigarette volume, and that's all we did.
And today, 89% of African American smokers use menthols. Know the truth, spread the truth.
So again, the use of menthols and kind of flooding the neighborhood, appropriating culture, putting it into advertisements, just like the one that we saw at the beginning of this section. It makes it look cool. It makes it look fun. It makes it look like part of an identity, right? But what it really is doing is it's hooking people and eventually killing them, right? And so this is what the tobacco industry does to these vulnerable communities. And this is one example of how they've targeted the African American community. 81% of Black smokers use menthol cigarettes. This actually makes it easier to smoke. The menthol flavoring, I guess you can say, makes it easier to inhale. It makes it smoother. It doesn't have such a harsh harsh chemical feel in your throat. So it makes it easier to smoke. It makes it easier to smoke more often, which also makes it harder to quit. The past couple years, there have been research done on menthols, and the research has suggested that the menthol flavor actually makes it harder to quit than your standard just regular tobacco cigarettes. Something in the chemicals, something in that flavoring actually makes it much more addictive than just your regular standard cigarettes. And so even there, not only just targeting this community, but also making it harder for them to quit. The tobacco industry strategically and aggressively targeted this community specifically with menthol cigarettes for decades. More advertising in predominantly Black neighborhoods and in publications that are popular with Black audiences. So appropriation of Black culture in marketing. This includes having events or sponsoring events like jazz festivals, hip hop festivals, really flooding that community and their interests with some of these products. And then menthol has also repeatedly been exempted from legislation on flavored tobacco products. And this is the result of massive tobacco industry lobbying. So for instance, if there are any restrictions on flavored tobacco products, even though menthol is kind of a flavor, it is not considered a flavored tobacco product. So for instance, if there is a ban on flavored tobacco products, much like California, sometimes menthol is not included in that. And so the tobacco industry has really, really sunk a lot of money in the lobbying efforts to keep menthol out of that flavored product identifier so that they can continue to sell them without restriction. Another vulnerable community that the tobacco industry has a history of targeting is the LGBTQ plus community. 33.5% of Americans identify as lesbian, gay, or bisexual, while 0.3% identify themselves as transgender. However, 10% of California students in public, middle, and high school identify as LGBTQ. So the LGBT community belongs to almost every race, every ethnicity, every religion, age, socioeconomic group. And our students, they have intersecting identities, right? And so this, again, makes them a very vulnerable group to target. There are higher risks for substance use there's higher risks for this community with substance use, sexually transmitted diseases, cancers, cardiovascular diseases, obesity, bullying, isolation. Like, again, this community is already vulnerable to other categories and other health social determinants. And so, substance use, tobacco use is just another one of those, right? They also receive poor quality of care due to the stigma of being a part of this community, lack of healthcare providers' awareness of how to treat those from this community, and the insensitivity to the unique needs of the community. So an example of that would be someone who might be someone whose sex might be assigned at birth as female, but identifies otherwise, may not feel comfortable disclosing their full health history to a doctor or a medical professional, or they do feel comfortable disclosing that information, but their healthcare provider is biased and does not administer the highest quality of care. So again, this group and this community is already at risk, besides the fact that tobacco industries are targeting them. Even go further and take that with our students, right? There might be some students who identify as LGBTQ plus, who may not feel safe disclosing that information to health professionals. They may not even feel safe or feel comfortable disclosing that to their own parents, right? And so if a student is experiencing addiction or experiencing some sort of health emergency, they may not want to report that because of what that may entail and the process of getting treatment and having to disclose information to others that they do not feel comfortable. 3 in 10 LGBT youth currently use electronic vapor products like e-cigs, which is 25% higher than heterosexual youth. And more than half of LGBT youth have tried e-cigarettes. That is extremely high. More than half, more than 50% of LGBT youth have tried e-cigarettes, when typically here in LA County, that number might be somewhere like 10%. So this community is also targeted by the big tobacco marketing, as you can see here in these images. Once again, just like the ones that we saw before, it makes smoking and vaping look fun. It looks cool. It looks happy. It also looks like acceptance, right? That these groups or that these companies are coming in and telling youth, LGBTQ youth, to take pride in all that they do, but also don't forget to smoke our products and joy, right? These companies will also fund or host drag shows, drag competitions, sometimes clubs for Pride Night. And so just like we saw the tactics with the Black and African American community, the big tobacco companies are also using those same tactics against the LGBTQ plus community as well. We know that there are intersectionality of identities for all people, especially our students. However, one thing to remember for our students that the more compounded the marginalized identities that there are, the bigger the gap is between the health equity and health inequity. So a great example of this would be a student who is trans, Black, and foster youth, right? This student has these three identities or intersectional identities. And because each one of those are vulnerable categories to this student who is trans, Black, and a foster youth is going to be more likely to use than not because of all of these determining factors. Transgender youth of color use vape products at a higher rate than their cisgender and white counterparts. So again, just kind of driving home that idea that when there are more marginalized identities, it puts that student at more risk of using for different reasons. Again, we know that for youth, one of the biggest factors that youth use is to basically cope with life, right? Cope with anxiety, cope with stress, cope with depression. And if we're seeing that our students are facing discrimination because of their LGBTQ plus status, because of their color, because of their socioeconomic status, maybe they're unhoused, these things are going to weigh on our students, and they are going to turn to vaping to feel better rather than seeking out the support and healthy coping skills that they need. 8.7% of LGBTQ youth are Black and African American, right? So again, some of those intersectional identities that really put our students at risk. So let's take all that information and really hone it into what it looks like in our schools. How does this impact our students? How does it impact their wellness, their achievement? How does this impact our school climate? Once again, this image is from the Truth Initiative. And I thought it just was really interesting because the idea that there are more tobacco retailers near schools in low income areas than anywhere else is very telling, right? Targeting our students who might be in low socioeconomic situations and what that may entail for our students, for their families, is really telling, right? Again, these tobacco companies really target the vulnerable. They know exactly what kind of tactics to use and which vulnerable groups to go after. So health disparities, student groups in our sort of to-be world, again, in our tobacco use prevention lens, is going to be defined as students who are prone to higher usage of tobacco products due to their social determinants of health. So again, that idea that tobacco advertising and tobacco shops are closer to schools in low socioeconomic neighborhoods than they are anywhere else. That is what we're going to be looking at through this lens, right? That these health disparities mean that students are prone to higher usage to tobacco products due to all of these social determinants. So for instance, children are more likely to smoke when they live or go to school in neighborhoods with high density of tobacco retailers, right? We already kind of talked about that. 40% of 13 to 20-year-olds reported that getting their vapes from retailer stores like gas stations and smoke shops, that is where they got them from. So again, 13 to 20-year-olds, right? Minors who are saying that they're not stealing these vapes, they're not getting them from adults, they're just walking into these stores, buying them, and walking out with the product, right? We know that that is illegal to sell to minors, but 40% is a very, very high rate. Even when our unit works with schools and talks to admin and talks to uh, SROs, that is usually the answer we get, is that students have reported that they're getting them from the smoke shop or the gas station on the corner before and after school. They know exactly which worker will sell them the products and which ones won't. And so this is a problem, right? Especially when these smoke shops are so close to schools. In some areas, they may even be down the street or across the street from a school. A lot of the schools that we work with report that students know exactly where to go. And they share that information with their classmates, right? And so even the proximity to these shops, to the schools, puts our students at risk. The CDE has identified the following groups as having desperately high rates of tobacco use. And some of these we've already talked about, right? African American, Black student groups. We talked about students who identify as lesbian, gay, bisexual, transgender, or queer. Foster youth is also another student group, Latino and Hispanic, Native Hawaiian, Pacific Islander, American Indian, Alaska Native. Students experiencing homelessness, students who are enrolled in non-traditional schools, so your continuation schools or juvenile courts, rural communities, and low-income communities. All of these groups, according to the CDE, have high rates of tobacco use, right? So again, just another indication that these student groups, these vulnerable student groups, are already reporting that they are using tobacco use, whether at school or in their lives, and it's putting them at risk. So let's take a look at these impacts, right? We know that this impacts graduation rates because students will drop out or fail. The graduation rate decreases, especially if we are using suspension and expulsion before using alternatives to suspension and support. We know that it also affects behaviors in school, which can lead to suspension and expulsion. And again, students who are out of the classroom due to suspension and expulsion are losing, learning time. They are losing instruction time, which again closely relates to graduation rates because students are failing grades, they're dropping out. It affects attendance. Students are more likely to miss school due to health disparities for different reasons, right? Maybe they don't have transportation or they don't have money for buses transportation. Their living situation is unstable, maybe illness because they don't have insurance or money for treatment. All of these things can affect their attendance. And again, that affects their academic success. They're missing school, they're missing learning opportunities. This can affect their grades, it can affect their test scores. Again, it could affect their decision to drop out. If they're failing all their classes, then why show up, right? So let's take a look at the data for these student groups, specifically in LA County. So first, I have a question for you. Drop in the chat. What grade do you think is the highest rates or has the highest rates of vaping usage in LA County? Which grade do you think has the highest use? 8th grade? 11th or 12th? Okay. Yeah. We tend to see 10th grade. Yeah, we tend to see, thank you for your responses. We tend to see that as the grades get higher, there's more usage. We also see that in the type of usage. You can't see that here, but we see a lot more cannabis use in the upper grades and a lot more nicotine use in the lower grades. But as you can see here from the California Healthy Kids Survey, the data from 21 to 23 shows that that increases from 7th grade to 9th grade to 11th grade, and then non-traditional schools. So again, non-traditional schools meaning your continuation schools, even independent study, juvenile halls. And you can see how they've increased, right? This is for all students. These are not specific to student groups. This is just all students in general. You see here that the highest is in non-traditional schools, right? We can come up with a lot of assumptions as to why. I kind of see it as, tobacco usage or vaping is really just a cry for help. Again, students are using these to self-medicate, to feel better. And we can maybe associate that with students in non-traditional schools in terms of, why are they in these schools? Are they struggling academically? What is the reason for that? But we know that 13% in LA County of all students is the highest, and that's coming from our non-traditional schools. We also looked at the California Healthy Kids Survey in terms of caring adult relationships. So from 7th, 9th, 11th grade and non-traditional, you can see here that those who said that they have less than pretty much true caring relationships, so basically saying they don't really have caring adult relationships, are among the highest users. Those who say that they do have caring relationships with adults, those numbers are lower, right? So for instance, if we take a look at 9th grade, 3 versus 6%. Those who say that they have caring adult relationships are using at 3%, and those who say that they do not are using at 6%. And in every single level, you see that those who report not having caring adult relationships are higher usage, which means that our students who don't have caring adult relationships are at higher risk of using e-cigarettes or vapes. And again, this can mean nicotine, this can mean cannabis, it can mean both. What this survey also reports is that those students who are experiencing chronic sadness are also at higher risk. Now, I want to be really clear. Chronic sadness really means when a student is like feeling sad over 30 days or more. This is not like having a bad day because they didn't do so well on a test, or they're having a hard time because they had a falling out with a friend or a partner. Chronic sadness means that they are experiencing this feeling or this depression for more than 30 days. And once again, you can see that those who experience chronic sadness are using at a higher rate than those who do not experience chronic sadness. So again, our students who are having a hard time, who may need some supports with maybe their mental health or coping skills, they are turning to vaping instead of using some of those healthy coping skills. And this chronic sadness puts our students at risk for using. When we look at gender for these groups, notice how those who are reporting either non-binary or something else are at higher numbers. So those students who may be a part of LGBTQ plus community, those who are not sure what they are feeling about their gender, they are at higher risk of using, because those in 7th, 9th, 11th, and non-traditional are reporting that they are using at higher risk than, say, their cisgendered students. Gender identity, you're also going to see the same, a similar trend. So those who identify as transgender or not sure if they're transgender or not, so again, still questioning and exploring their gender identity, are using at higher rates. So once again, our students who are needing support, who may not feel comfortable sharing their gender identity with others, those who are still questioning and trying to figure out their gender identity, are experiencing something that is contributing to their usage of vaping. Sexual orientation. So again, those who are not straight, gay, lesbian, bisexual versus those who are straight and heterosexual. Again, those who are not straight, that they are gay, lesbian, or bisexual, are using at higher rates than their straight heterosexual counterparts. We're also seeing those who are not sure about their sexual orientation are also using at a higher rate than their straight and heterosexual counterparts. Those living situation, these are large numbers. These bars are way longer than the ones that we've been seeing. For instance, in ninth graders in LA County, 43% of those who are experiencing homelessness are using vape devices. You can see those who are in foster homes are coming in at a close second. In non-traditional schools, seventh grade, those who have home with one or more parents or other living arrangements are kind of small, but we can see here that really those who are at risk are homeless and our foster youth students. Race and ethnicity, we can see here. Again, we're seeing very, very high numbers in our non-traditional schools. In 11th grade, mixed or two or more ethnicities and American Indian are at high rates. Ninth grade, it's Latino and African Americans. Seventh grade, Latino and African Americans. So this kind of just puts into perspective some of those, race and ethnicity groups. It can also mean the communities and the neighborhoods that these students come from. Are they being advertised within their communities and their neighborhoods more so in high populations of Latino and African Americans than their maybe white and Asian communities or neighborhoods? What is really accounting for this? So some new ideas. And the 2024 California Children's Report Card, which is that you can see here, you can see that some of the very lower grades are supporting mental health and preventing substance abuse, right? So the most important thing that we want to really focus on when it comes to our health disparities with the lens of substance use and tobacco use is really these two things, right? Personally, I think if we are supporting mental health, that we're really going to also prevent substance use, because we know that our students have reported, whether it's the National Youth Tobacco Survey or the California Youth Tobacco Survey, or even our CHITS surveys within our individual counties or schools, most students are saying that they are turning to substances to feel better, to address their anxiety, to address their stress, their depression. And so if we're really doing a better job than a D+ in supporting mental health, then we're going to do a better job in preventing substance abuse and raise that D- higher, right? And so these are some things that we really need to focus on in terms of teaching students resiliency skills, coping skills, SEL, really addressing the student and the whole child in order to help prevent these things. So one last question for you before we wrap up. In the chat, think about a successful strategy that you are already doing at your school, in your district, in your organization that addresses health disparities. Just very quickly, it doesn't have to be a full explanation. What are some things that you are doing? What strategies are you doing? Maybe your school or your district has community schools. Maybe you have a wellness center. Maybe you have some student clubs and groups that does specific substance use prevention within the Hispanic, young Hispanic leaders group. Maybe it's the ASB. Maybe it is your maybe it is in a class. Maybe it is a civic engagement class in your history class or your government class. What are some strategies that you are already doing at your district that you can say, yes, we are addressing health disparities within our school for our school population? Well, if we don't have any, you are in the right place because this is going to lead us to something that I get to share with you. So this brings us to our points of our resources. And if you are can't think of any strategies of how you are doing this in your school, I've got something for you. Today's webinar was really a part one, just a general overview of what are health disparities? What does this look like in our schools? How is it affecting our students? Part two is really the application piece. So part two is health disparities, student engagement, activities and action. And this is actually a 1.5 hour webinar on how you can now start employing strategies to address these health disparities in schools through the 2B lens. So addressing tobacco and vape use. This training is a pre-recorded training, so you can watch it at your own discretion, at your own pace. You can find that in the link that was just dropped in the chat, or you can scan that QR code. In this training, you will be given lots of strategies, different printouts, a whole wealth of information. I believe there's even a Google Drive that has been organized between different student groups, focus groups. And then within those folders are different strategies that you can use to address those different health disparities for those different health student groups. So please go ahead and take time to look at that. You can either access the YouTube video, or if you just want to look at that Google Drive, please feel free to do so. Everything can be found there. For today's purposes, if you are looking for resources in any of the topics that we talked about today, here are some resources in terms of those student groups. So for instance, Amplify is an African American coordinating center specifically around changing the narrative of African American and Black community and their relationship to tobacco use. You have the LCC, the Latino Coordinating Center, which does the same thing, but for Latino groups. You have the statewide Pacific Islander Asian American resource. And then we also have just some general ones. The Truth Initiative, which is where a lot of this information and videos came from. Of course, your CDC website that has a lot of different information specific to ethnic and racial groups. The TCCC website, which is the tribal communities specifically for Indigenous and Native Americans. Everybody's school looks different. Everybody's community looks different. And so if some of these resources speak to the demographics of your students and your campus, please feel free to access those. When I share these slides with you later, all of these are hyperlinked that you can click on and it will take you straight to those websites. Just a reminder, our unit offers all these different types of supports, including signage for your schools, technical assistance in terms of helping you and your site through curriculum, prevention curriculum, intervention programs, youth development. We do school and staff trainings like this one, or if you're looking to train your entire staff, we will also come out to your school site or do a Zoom specifically for your school on topics that you feel you need. We also do caregiver and community presentations. So that means student presentations, parent presentations. We do coffee with the principal, tabling your next event like school, back to school nights or a health festival. We also offer educational materials at no cost. So if you are having a back to school night and you want to have a table of information about tobacco and vaping, we have a catalog there and an order form that you can order. And if you're looking for trainings, both upcoming or past trainings, we do have a training catalog that has information for all of our upcoming trainings and how to register. That will look like this. All of our trainings are free and recorded. So if you ever need to refer back to a back training, all of our trainings are housed on our YouTube. Or if you just want to sign up for a training, but you can't make it, go ahead and sign up. We'll send you the recording anyways. I want to thank everybody here for being here and participating. I'm going to ask one last participation. If you can please participate in our survey. This really helps guide our trainings to know exactly what it is that you're looking for and how to really offer our trainings and what is needed. Our contact information is here if you have questions or if you'd like to meet with us and help and support with the work that you do in terms of tobacco use prevention and intervention. Go ahead and email us there. You can call us or visit our website. But other than that, I want to thank everybody for being here. I hope you have a great day, great Thanksgiving, and I will stay on for questions.